Industrial action by members of the union Nehawu has brought laboratory services to a halt countrywide. The strike comes after talks between Nehawu and the National Health Laboratory Services reached a deadlock on wage increases. Last month's forensic workers' strike in Gauteng brought the mortuary services to its knees. Families were left fuming as they couldn't bury their loved ones. The strike has since spread to other provinces. The National Health Laboratory is responsible for diagnostic pathology services. The strike will impact on healthcare workers and patients who require blood tests and urgent diagnosis. Nehawu says that it has encouraged its members to leave a skeleton staff behind, but there are allegations that striking workers are preventing samples from being taken to private laboratories. The union has called on the National Health Department to help break the deadlock in wage negotiations. Well, to help us unpack this a little bit more, we're now joined in studio by Nehawu Head of Organising, Mr. Clement Marule. Thank you very much for joining us and welcome to the programme.
Thank you, Peter.
So, what's this strike about?
The strike is about mainly 5 areas. It's about the cost of living adjustment. Secondly, it's about the performance proficiency matrix assessment, and secondly it's about the performance pay progression. Thirdly, it's about the insourcing, and lastly it is also about the medical aid that must be adjusted equally with the percentage that should be affected on call.
How long have negotiations been in play that this has become your last resort?
We started early this year. So it's just that they were very slow in terms of the normal pace of negotiations. But we've gone through all the rounds of negotiations. We've gone through the CCMA for dispute resolution and so forth. But we've also gone through the National Department of Health for intervention. And we're still hopeful because from time to time we are meeting with the board of the NHLS to try to unlock the dispute.
So how far are you in terms of unlocking this? Is there an agreement close?
We're thinking that we're very close because at least at the level of the cost of living adjustment, we are consulting on what they offer. They have offered the 7.3%, which we are busy consulting our members on. And on the performance metrics, we are just not agreeing in terms of the time frame because they have just requested 2 months to finalize the scoring system. So if we agree in terms of the timeline to say immediately after 2 months, they must implement those particular, performance metrics. And on the performance pay progression, there is a consensus at least there. On insourcing, we are also negotiating or just tweaking the question of timing. But the big one that we have not had any offer yet is on the medical aid, that we are demanding that medical aid should be increased by the very same margin of the.
Are you waiting for everything to be sorted out, or can you say, look, we've got quite a bit already, maybe it's time to go back to work, and then we'll sort out the balance as we're working?
It is unfortunate because we can't take piecemeal. So we want, that's why the 5 are not the only things that we have demanded. We have narrowed them because there's a little bit longer list, because there's also housing allowance that is demanded, the rural allowance, the danger allowance and so forth, the shop steward time off and so forth. But we have zoomed in on the big 5 to say if we can come closer on the big 5, we're thinking that our members will consult them, they will be reasonable enough to consider such a package.
Some patients might die because of what you're doing, this strike, because they won't get urgent diagnosis of their illnesses.
Well, we are very alive. We are a health union. We are very alive to that. That's why we have declared our availability to the board of NHLS, to the executive management of NHLS, to say anytime around the clock we are available. And I must also say on record that tomorrow there's a meeting scheduled at 8 o'clock in the morning. So we are because they had a meeting of the board yesterday and today. So we're hoping that tomorrow morning they will come closer to what we have said they must look into.
So you're saying that certain emergency testing will continue and carry on with the skeleton staff, and that anything that's not urgent you're not going to address?
Yes, we have today. We've been in particular at the head offices of NHLS. We have been addressing our members to say because we've been interdicted in terms of the conduct of members that were blocking service providers to enter the premises. So, but we have since talked to our members to say they should allow those particular non-union members to access the premises, the service providers to access those, so that they should also not lock the gates of the employer, so that we have a very peaceful industrial action.
So if your issues don't get resolved soon, are you just going to stay on strike indefinitely?
That's the mandate that we have currently, but we are very hopeful. With the pace that the board is moving, contacting us from time to time, we're very hopeful that very soon we'll get a settlement.
All right. So we saw the mortuaries sector go on strike. Now we're seeing this pathology services go on strike. Are there other issues that are bubbling under that we might see Nehawu again at the forefront in leading workers onto the streets?
Yeah, well, for now we were concentrating on the NHLS. We don't know of any other. But this is a very difficult year across all sectors of our economy, because there are difficult wage negotiations, and the big ones that are coming are the public service. We know that the public service is going to be starting their wage negotiations. That's the big one. So we don't want even to anticipate now, but that's the big one that we are looking up to. So we're hoping that we will also not going to be on the streets on the public service one.
Has the Department of Health been assisting?
Yes, indeed. The National Department of Health, through its Director General, has been very intervening, very helpful to us, and we're hopeful that we're also playing along and assisting to that regard, because every time she calls us, we make sure that we meet with her to deal with this particular dispute.
All right, Mr. Marule, we hope that it gets resolved very quickly and that you're up and running sooner rather than later. That was Mr. Clement Marule, who's the head of organizing at Nehawu.